Good Tuesday afternoon, and thanks for joining us. I'm Dr. Martha Buchanan, Public Health Officer and Senior Director of the Knox County Health Department. Our moment of gratitude today is dedicated to the people who participated in Friday's Big Honk, including Mayor Jacobs, Mayor Concannon, Congressman Burchett, and several other elected officials and friends of Knox County Health Department. Our team is working incredibly hard, and it is special to see the parade of cars honking and driving around our building, recognizing the work we are doing. We know that there have been a few questions and requests for more nuanced information related to the metrics and benchmarks in our plan. Our team is constantly looking at ways to provide more clarity and information. We're exploring ways to represent that on our website this week. As we touched on yesterday, our goal is to satisfy the desires of both the data lovers in the community, in our community, as well as those, while also taking into consideration the desire of people to have a more simplified explanation, the folks who just want to know how we're doing. Our website aims to accomplish this for both groups by providing the metrics and the benchmarks, while also utilizing the traffic lights to help represent where we are in an easier to understand format. We are continuing to evaluate our website, and we anticipate the local situation to evolve. As we gather more data, we will provide more clarity and information on our website as best we can. Moving on to our local situation. We have 252 confirmed cases of COVID-19 in Knox County. 209 of those have recovered. 35 individuals have been hospitalized at some time in their illness, and 2 are currently hospitalized. We gratefully are able to report we've had no further deaths from COVID-19. Before I open it up for questions, I want to talk a little bit more about masks. Wearing masks or face coverings in public protects the people around you, and vice versa. They're wearing a mask protects you. It's also one of the 5 key principles that everyone should be doing during this time while we're trying to reopen. It's important to note, and we've been asked why I don't wear a mask while I'm giving this briefing. I'm in a room with a very limited number of people and am adequately distanced from them. Our sign language interpreter is in a totally different room. Additionally, it would be very difficult for you to understand me were I to wear a mask during the briefing. However, when I'm out, going to the grocery store, running errands, I do wear a mask. Especially in places where social distancing cannot be accomplished. Sometimes those grocery store aisles are kind of narrow. So you'll see me in a mask when I'm out in public, running errands or doing things in town. And sometimes even here, if I'm in a meeting where we can't accommodate social distancing, although we're doing much of those virtually now, so we can accommodate social distancing. So now I'll open it up for questions.
Go ahead and submit your questions. And as a reminder for people watching on Facebook Live, we are answering questions from the media that are submitted via a live Zoom chat. And we are answering these questions from the media in the order in which they're received. So just so people watching on Facebook Live have an idea of our process here. Our first question is from WBIR. They say, we sent in a picture one of our reporters captured of a large group in the Fort area over the weekend. Is there anything you want to reiterate regarding safety/large groups, and what does enforcement look like?
So first of all, I want to just say that the guidelines are, the 5 basic principles are pretty straightforward. Social distancing is really important. It's a big piece of our plan, and our community taking responsibility for social distancing is another big piece of that plan. So our plan relies, like much of public health does, on people doing the right thing, on following our guidance. And it's really important. It's unfortunate when they choose not to, because what those people are doing is putting our entire community at risk, not just themselves, but our entire community at risk of having to step back in reopening or not moving to the next phase. So it's not just their own personal risk that they're risking, health that they're risking. In addition to that, they're risking the health of others they may have contact with, who maybe they don't get so sick from COVID-19, but their grandmother or their mother or grandfather or father might become very ill from COVID-19 and might end up in the hospital or even die. We know older folks are more likely to become severely ill from COVID-19. Regarding our ability to impose the guidelines or regulate the guidelines, we regulate several industries throughout the year. And part of our regulation is always about education and information. So our regulation starts with education and information and moves forward from there based on public health law. When we look at these isolated instances of people gathering, that's not something that we can police. We want people to police themselves. If you show up somewhere and people are gathering and you don't feel comfortable, you can do lots of things. You can leave, you can say something to the host, you can put your mask on to protect the people in the crowd. So again, we really are heavily relying on people to do the right thing and make those choices to protect themselves and others around them.
From WVLT, a similar question. They ask, what are fines/penalties for people not following the guidelines or people not practicing social distancing guidelines? They say they know that KCHD works with education at first, but what is the dollar amount for the fines?
So under public health law, I don't have the authority to impose fines. The way public health law works is first thing called a health directive, and that's a sternly worded letter that comes from me and asks the company or the individual to comply. They're given opportunities to prove that they can comply. And if that fails, the next step is called a health measure, which could include a court order to make them do what we're asking them to do. That might be wearing masks, that might be closing, but those are the steps that we take. They are allowed to be heard, and they have a part in that. So we follow due process.
From the Sentinel, what is your target number for the number of tests conducted weekly in Knoxville?
It's a great question. And we've talked a lot about testing. Testing is one piece of how we see the burden of disease in our community. And we don't have a set number. There's no absolute number that we know is the magic number. If we do enough of these tests, then we'll know for sure how much disease we have in our community. What we have chosen to look at is our capacity for testing increasing? And the answer to that is yes. So that means we know more people are getting tested. We also know that we are not aware of every test that's done in Knox County, because not every test that's done in Knox County gets reported to us. That's a new system, a system that's not as reliable as we'd like it to be. So we know that we're not aware of every test being done, but what we are aware of is that the number of tests available in Knox County is going up, and we're happy about that.
Also from the Sentinel, what is the minimum staff you would consider acceptable for public health capacity?
Wow. So right now we have about 30 folks working, and based on our just on contact tracing, and based on our caseload currently, we're able to handle that with 30 staff. When you look at the literature, it recommends 15 people or so per 100,000 population. And so that's 60 or more, about 60 for a little more than 60 for us. We have the capacity to expand up to over 100 people to do contact tracing. So we feel very comfortable that we can expand as we need to. We have a system we've tested. We know it works, and we've put together different teams with people with different responsibilities. So it's not just one person doing all of that. And so we know we've got a plan and a training, and we're ready to go, and we can staff up to over 100 people.
From WVLT, they're asking for the data on the number of recoveries after being placed on a ventilator. I'm sure people would love to have that information. That information is not information that is reported to public health. And that information would actually require us to actually get permission to do chart reviews and things like that to get who was put on a ventilator and then recovered. What is important is what we're reporting on our website, and you can see ventilator availability. What people want to know is, are there ventilators available? If I were to get sick and go to the hospital, will I have a ventilator? And I think that's on our website. We're also reporting about hospitalizations, but not down to the specific, did they get put on a ventilator or not? From WVLT, they want to know the number of tests done at local nursing homes and assisted living facilities.
So we are doing some of those tests, and honestly don't have that number off the top of my head. So if there's two cases in a nursing home or assisted living facility, we're going to go and test the residents and all the staff. We've done that a couple of times. But then some nursing homes are doing their own testing because they have staff who can do that. Those larger companies are able to obtain supplies that they need and are doing their own testing. So we don't have that information. They don't have to report that to us, but I am aware that some of them are doing testing. We do have plans to do targeted testing with our nursing home and assisted livings across our community. I believe the state also is planning to do some of that.
From WBIR, at this point, should people be inviting people over to their homes at all?
People can invite people over to their homes as long as they can maintain social distancing guidelines. And remember, we're still recommending less than 10 people gather at one time.
From the Sentinel, what would be considered a surge on the healthcare system? What level of demand would you need to see?
So that's a great question. And it's actually a great question for hospitals. If you look at our website, there's information on there about surge capacity. And we put that, the hospitals have put that information out. We'll actually have somebody from the hospitals here Friday to talk about the current situation and possibly answer questions about surge. They put out a really well thought out plan about how much they can surge up to. And so they're capable of surging much higher than what the numbers of beds you're seeing right now.
From WATE, 2 zip codes, according to the website, 37919 and 37923 have seen the highest number of COVID-19 cases. Have any COVID-19 hotspots been identified in Knox County?
We don't have any hotspots in Knox County. What we have is community-wide spread. So there's a risk for COVID-19 no matter where you live, work, or play in Knox County. That's just the truth of what we have going on right now. We have had some clusters, but we've been able to isolate those groups, get them into isolation or quarantine, and observe them for the time period recommended. So we feel good about that. Again, that's part of our contact tracing and other teams that are working on doing that. But again, we don't have hotspots in Knox County. We have places that have higher numbers of cases than other places, but not necessarily hotspots.
From WVLT, what is the difference in a restaurant and bar being open? Several places are open that don't sell food. If you have concerns about regulations, our 215-5200 number is the number to call. I think there's a lot of nuance to that, and our staff know those rules. And so if you have a concern, I encourage you to report that, and we'll look into it. From the Sentinel, the Metro Public Health Department in Nashville has set out clear targets for the number of tests per week, curve flatness, contact tracing staff numbers, and other metrics. By clear targets, I refer to well-defined target numbers and ranges that the public can quickly compare and evaluate to the data presented on their website. Why have you declined to do so on your website?
Well, part of the reason is that they actually have a much larger caseload than we do, and they have a lot more data to be able to define those metrics. As we move forward and have more data and are able to define metrics, we'll move toward that.
Any other questions? Please go ahead and submit them now. All right, since there are no other.
Okay, I'm sorry, I'm going to interrupt you, Kelsey. So just to review, I talked about our 5 core actions: wearing a face covering in public when you can't maintain social distancing, regular hand washing, staying home if you're sick or been asked to stay in isolation or quarantine, social distancing, and cleaning surfaces regularly. Everybody can do that. It's not rocket science. Anybody and everybody can do it. We're asking everybody to do it so that we can move forward and not backward in our plan.
All right, we have another couple questions that just trickled in. From the Sentinel, you have said in pressers that you have plenty of data for people who want data, and that the traffic lights are there for those who just want a general sense of what's going on. However, it's hard to tell what the traffic lights mean without clear borders between red, yellow, and green. Why have you chosen not to make those borders public? So
I believe we've given all of you an option for how you can ask those questions to us directly, not in this venue, but that you've been asked to submit those by email, and we'll be getting back to you with those answers.
From WVLT, when will antibody tests be available in Knox County?
Great question. And I wish I knew. What we know now is antibody testing is still in process of being validated so that we can actually use it meaningfully. We don't want to have a test that we can't use and rely on the results to really tell us about whether you have a disease or you don't have a disease and whether you're immune or not immune. And just a little bit about immunity. Immunity to COVID-19, we are not sure how long lasting it is. So even if you have a positive test and you recover, you still need to be careful. We're not sure how long immunity lasts for COVID-19.
All right, any other questions? Please go ahead and submit them now. All right, thank you all for joining us, and we will be with you again tomorrow at 12:30. Have a good rest of your day.